I'd like to especially thank our co-hosts, Ambassador Ishikani, Ambassador Ahmadazi, and Ambassador Siwahuk for their exemplary and consistent leadership on universal health coverage. As we approach the end of this challenging year, to say the least, I can think of no better day to come together and reflect on our common mission of health for all. On behalf of the World Health Organization, I would like to thank all of you for your collaboration and commitment to defeating COVID-19 and building a healthier, more sustainable world for all. In the midst of the worst global health crisis in a century, we have seen inspiring examples of leadership and innovation, as well as the development of new partnerships and initiatives and mechanisms that will not only help us respond to and recover from the pandemic, but will bring us closer to achieving UHC. From your generous contributions to the ACT Accelerator and the Strategic Preparedness and Response Plan, to collaborative efforts to promote public health functions and combat misinformation, my colleagues and I at WHO are grateful for your good work and support, both nationally and internationally, to respond to the pandemic, strengthen health systems, and improve health equity. We know that the pandemic is more than a health crisis. It is a human crisis that has reversed progress on human development for the first time since 1990. There is no doubt about the connection between public health and the broader resilience of societies. COVID-19 has shown that universal health coverage, strong public health systems, and emergency preparedness are essential to communities, to economies, to everyone. Now is the time to invest more and smarter in health systems that protect lives and livelihoods. We cannot afford to do otherwise. Universal health coverage is not a luxury or expression of altruism. It is a conditioned precedent to pandemic preparedness. And as bad as COVID-19 is, it is not the 19 influenza. Nature is not finished with us. We must learn the lessons of this pandemic to be ready for the next one. And lesson number one is that universal health coverage cannot merely be a goal. It must be an imperative. And the political declaration on UHC, world leaders came together to endorse last year, is our blueprint for meeting this imperative. Nearly 40 years ago, Dr. Joshua Lederberg, Nobel laureate and one-time president of the Rockefeller University, wrote, "Bacteria and viruses know nothing of national sovereignties. The microbe that felled one child on a distant continent yesterday can reach yours today and seed a global pandemic tomorrow. Never send to know for whom the bell tolls, it tolls for thee." In 1988, when Dr. Lederberg wrote this, it was prophetic. Today, it is fact. And it is this fact that must animate our work to build back better. We must have universal health coverage because none of us are safe until we all are safe. Now I'd like to hand it over to my colleague, who you all know quite well, Werner Obermeier. Werner will moderate today's event. Thank you again. Werner?
Thank you very much, Stu. It really is a pleasure to be with you all good friends of universal health coverage this morning. May I first ask the co-chair of the group of friends, the permanent representative of Japan, Ambassador Kimihiro Ishikane, to make opening remarks.
Well, thank you, Werner. Well, Excellencies, distinguished delegate, do you hear me, by the way? Distinguished delegates and ladies and gentlemen. Well, I would first like to express my appreciation to the members of the group of friends, today's speakers and partners, including WHO, IFRC, and UHC 2030 for attending this meeting. And allow me to also congratulate all of the member states on the successful handover of the joint statement in support of US Secretary General's policy brief on COVID-19 and universal health coverage, with 120 member states as co-sponsors. The unprecedented human security crisis caused by COVID-19 has highlighted the importance of achieving universal health coverage in every corner of the world. As the Northern Hemisphere enters the winter season, we cannot afford to let COVID-19 infections run wild and become totally unpredictable. With its multifaceted threats to the lives, the livelihoods, and dignity of so many people, it is imperative to ensure that we do not overlook the health of every one individual person among the most vulnerable populations. As a group of friends of universal health coverage, we believe that UHC and a resilient, effective health system is one of the most important factors in combating COVID-19, as well as in preventing future pandemics and minimizing the social and economic impacts. Today, we will hear from several speakers about their experiences in dealing with COVID-19 in different places, but in particular in Africa. Through today's discussion, I hope the relevance of UHC in the COVID-19 context will be reaffirmed and the commitment of our leaders to the political declaration UHC will be renewed. And finally, I would like to welcome more countries to join with new ideas to this group and with suggestions. Thank you very much.
Thank you very much, Ambassador, and specifically for the many years of support from Japan to universal health coverage through the SDGs and beyond. May I now ask Ambassador Kaha Imnatse, the permanent representative of Georgia and co-facilitator of the UHC political declaration of last year, to make his opening remarks.
Thank you, Werner. Thank you very much, Werner. Good morning, dear colleagues. Rather good afternoon already. Indeed, a year has passed so fast since we adopted the political declaration on the universal health coverage. And recalling that moment, probably that was the most meaningful thing I've ever facilitated from all the things that I've done here. And nobody could have predicted that we would have this horrible pandemic when we were working on the universal health coverage political declaration. But what we have seen through this pandemic, and my friend Ishikane has mentioned it, I fully support what he said, and also what Stu said in his opening remarks, this pandemic exacerbated absolutely everything. And we start to see things from a different perspective now. It is a development crisis, and we are not secure from any future occurrences of this kind. And we've seen a lot of measures by different countries in combating, in trying to mitigate the measures. And those were some drastic measures, the lockdowns and so forth, but all these are rather temporary and symptoms. What we need to do, we have to learn how we are going to live with the viruses and bacteria that outnumber by and large the population in terms of numbers. So the first line of defense in these circumstances is indeed the health infrastructure, not just the doctors who are doing great work, but the infrastructure itself and the trust in that infrastructure on the part of people. So if we put all this together, we get the universal health coverage. So the universal health coverage is indeed a way to a global solution, so that during this pandemic or any future pandemics, if somebody gets sick, that person is admitted, gets proper treatment, comes back and continues work within the society. And it is the universal health coverage that is both the medium, the means, you name it. Therefore, once again, I also want to congratulate everybody on the UHC Day, those who have vested interest in universal health coverage and those who are the believers in universal health coverage. And I want to close by saying this, that it has to be the choice of the society, in what kind of society we want to live in. We want to live in a society of individuals, or we want to live in the society where we take care of the society at large. And universal health coverage, again, is the way toward that, making sure that nobody is really left behind. It starts from health in global terms. So thank you again, and I yield at that, and welcome to all the participants who joined us this morning. Thank you.
Thank you very much, Ambassador. The last speaker in the opening segment is also a representative of a country, Thailand, which has long supported universal health coverage and WHO, and a fellow co-facilitator of the UHC political declaration of last year. So it is an honor for me to introduce Ambassador Vitiva Srivihook to make his remarks.
Thank you very much, Werner. Excellencies, distinguished colleagues, at the outset, I would like to join Ambassador Kimihiro, Ambassador Kaha, and Mr. Stuart Simonson in welcoming you all to the virtual 2020 Universal Health Coverage Day commemorative event. Today, we are still moving together to build a healthier world for all. On the International UHC Day this year, we meet virtually, not to celebrate our success, but to be reminded of the reality where half of the world's population still lacks coverage and access to essential health services. The COVID-19 pandemic has exposed and exacerbated these pre-existing vulnerabilities. We therefore reiterate the urgent need to deliver our commitments in the political declaration of the high-level meeting on UHC, as we have seen the cost of not doing so. In this regard, I wish to take this opportunity to thank all delegations who have co-sponsored the joint statement in support of the UNSG policy brief on COVID-19 and UHC, initiated by the co-chairs of the group of friends of UHC and global health. To truly achieve health for all, we need to bring this same spirit back home and across all sectors. Earlier this week, the Thai Ministry of Foreign Affairs and the Ministry of Public Health co-organized a UHC Day event in Bangkok with our partners, such as the WHO Thailand Country Office, joining the discussion. The event was also attended by over 100 participants from different sectors, who we hope will be inspired to continue to carry out the work on UHC and deliver tangible results on the ground. Let us uphold this good spirit and really walk the talk during this critical decade of action and delivery of SDGs to recover from COVID-19 stronger and to achieve a healthier world for all by 2030. I thank you.
Thank you very much, Ambassador. And thank you once again to the three co-chairs of the group of friends for taking forward the statement of support for the SG's policy brief on UHC and COVID-19. It's no coincidence that that was the final policy brief that the Secretary General issued, also illustrating his personal commitment and the importance of moving forward to health for all as the key response to this pandemic and when we rebuild later. The next segment features some selected remarks from a number of important contributors to the agenda of universal health coverage. And the first person to speak will be the President of the General Assembly, His Excellency Volkan Bozkır.
While there will be many lessons learned, when we have time to reflect on the COVID-19 pandemic, one clear standout is the fundamental need for healthcare for all. Today, as we recognize the International Universal Health Coverage Day, we must acknowledge that while facing the worst pandemic, at least half of the world's population still do not have full coverage of essential health services. And over 800 billion people spend at least 10% of their household budgets to pay for health. As we move into recovery from COVID-19 and learn from its impacts, it is important that countries honor their commitments in the first ever political declaration of universal health coverage of September 2019. We must be prepared for the future. This includes addressing the projected shortfall of 18 million health workers by 2030, mostly in low and lower middle income countries, and the fact that 9 million additional nurses and midwives will be needed to achieve SDG 3 on health. If we have learned one thing this last year, it is how much we need these everyday heroes. It is high time the world expanded their investments in core health systems. Quality and affordable healthcare is the foundation for individuals to lead productive and fulfilling lives and for countries to have strong economies. It is time to invest in our strongest asset, to invest in our people and their health and well-being. Thank you.
I would like now to introduce Dr. Ketinji Kitai, the Chief Executive Officer of AMREF, who, as part of the leadership of UHC 2030, played an instrumental role in the lead up to the high-level meeting on universal health coverage and really harnessed the support of all stakeholders from civil society groups through private sector and the UN system. Dr. Kitai?
Thank you. Thank you very, very much. And glad to meet all of you. I think first, I would obviously like to thank Georgia and Thailand for the support they gave us last year for leading to the Universal Coverage Declaration, and also, Japan for the support of hosting the Friends of UHC that took us where we are. At that point, when we were debating and discussing and getting the support of these great member states and colleagues, we had no idea that actually the COVID-19 would be coming our way in a few months down the road. And we did talk a lot about preparedness, about health system resilience, but we never knew. We thought that would be a distant reality. We didn't think it would be something that, if we knew, we would have paid more attention to it at that point. But it just reminds us that just like any other emergency, you can never tell when the emergency comes. And therefore, you must always build systems that are ready for emergencies, that are ready to protect people irrespective of the situation. And I think when I reflect on this, and even at UHC 2030, we have quite reflected on this, that we did not pay enough attention, even as we are developing the UHC conversation, on population health and what we may call public common goods for health. We didn't pay a lot of attention to common goods for health. And now COVID-19 has come to remind us that we need to pay more attention to common goods for health. The COVID-19 pandemic has had substantial health, social, and economic impact. In Africa, we keep being told, Africa has been spared the pandemic, which is a word I do not like to hear anymore, because whereas the number of, the case fatality rate may be lower than other areas, the impact on people's lives, social and economic impact, is so severe that Africa is having its first recession in so long, maybe over 25 years. That's going to make it even more difficult for Africa to achieve universal health coverage because of the impact on the fiscal space. It's taken our gains on women and girls so far behind, and even vaccination programs. So I think this has come to remind us that UHC has to be continuing to be the agenda on our tables, on our desks, and in our drawers every day. It has reignited the debate on health emergencies, as I said, and how to make health systems resilient, especially for vulnerable. Because we've seen even in Africa, the already existing vulnerabilities in poverty, in gender, in areas where we don't have any access to care. We have probably 80% of African people without access to universal health coverage or even to service coverage that has financial protection. COVID has come to exacerbate that. I will let this committee know that recently we've seen even the minimum social health insurance structures available, because they're not well pooled, have actually declared COVID treatment an exception or an exclusion. You can imagine the middle of a pandemic being told you're a member of the national social scheme in your country, but you won't be covered for COVID treatment. It's a disaster. And this is really what we are saying. We must build really resilient systems. So we are basically saying that the conversation we started at the UN high-level meeting all culminated in the high-level declaration that well-functioning resilient health systems based on primary healthcare are the bedrock for progress towards the interrelated goals of UHC and health security, this is the time to refocus on them, to continue focusing them as a political choice. And we must demand action at the highest level, but that action must be demanded from the lowest level in the government by civil society. That's where the real accountability for goals will be achieved. And we've seen in the UHC state of UHC report by UHC 2030, we've seen reaffirmed the importance of civil society. So in conclusion, I would just like to say that UHC commitments must not be dropped during the emergency. They must be reaffirmed, accelerated as the bedrock of this response and future pandemic responses. Thank you, and back to you, Werner.
Thank you very much for that powerful message. I would now like to turn to Dr. Takao Toda, who is the Vice President for Human Security and Global Health at JICA.
Dear friends from all over the world, I'm honored to have this precious opportunity to join you virtually from 11,000 kilometers away in New York. Let me first express my heartfelt respect to my African friends for your devotion to safeguarding the lives of African people who are in the midst of complex turmoil triggered by COVID-19. Thanks to your dynamic actions and thoughtful efforts, the African continent is, comparatively speaking, successfully coping with various challenges by making full use of institutional assets and human resources in Africa, in close collaboration with the global society represented by the United Nations, the World Health Organization, and member countries, including Japan. As a small individual practitioner of global cooperation, I have witnessed remarkable efforts by key African stakeholders and institutions, such as Noguchi Medical Research Institute in Accra, Ghana, Kenya Medical Research Institute in Nairobi, Institut National de Recherche Biomédicale in Kinshasa, DRC, Nigeria Center for Disease Control in Lagos, and other important bases of the African CDC, and many other core medical facilities and hospitals, such as Entebbe Central Hospital in Uganda, Cairo University Pediatric Hospital in Egypt, the University Teaching Hospital of Zambia, Joshua Marcel Hospital in Angola, Centre Hospitalier Universitaire Cocody in Ivory Coast. Your collective efforts have not been limited to the health and medical sector, but have touched a wide range of sectors, such as water and sanitation, food and nutrition, and even to the education sector for raising awareness of kids, people, and the resilience of societies. Dear friends, allow me to reiterate Japan's renewed commitment to cope with our common challenges of COVID-19. Japanese Prime Minister Suga clearly stated with his strong conviction and commitment that the spread of the novel coronavirus is a human security crisis, posing a threat to the lives, livelihood, and dignity of people all over the world, and that the global community must work together to overcome this crisis based on the guiding principle of leave no one behind. Along with the Prime Minister's commitment, Japan International Cooperation Agency, JICA, will not only boost its effort to protect people's health and dignity through a holistic approach, but also intensify its immediate efforts to strengthen the case management system for COVID-19 seriously ill patients at those core hospitals to protect their lives, utilizing the latest knowledge and technology and experience in Japan, including ICU, D2D, doctor-to-doctor telemedicine. Dear friends, let us not forget that COVID-19 has provided us the greatest opportunity for learning from this pandemic to create a new world in which the achievement of universal health coverage, UHC, is the most urgent and prioritized global agenda toward which we must devote all our energy and resources. For the new world to be realized in Africa, in Japan, we pledge to continue our joint efforts with you, African friends, friends all over the world who have infinite love for Africa. Thank you, merci, obrigado, gracias, shukran, asante, ありがとうございます。
Thank you very much for that statement that really points to the challenges being faced specifically in Africa. But for any challenge, there is always an opportunity. And I think Dr. Todap highlighted those as well. We now have two brief videos. The first is a summary of the State of UHC Commitment report, which was recently launched by UHC 2030 and which Dr. Gitai referenced in his statement. And this is a compilation of baseline and national commitments on universal health coverage, and also serves as an accountability mechanism to show and measure progress made in implementing the political declaration adopted last year.
About their health, their finances, and their futures. Trust in some governments is eroding.
Poor and marginalized communities are being pushed further behind. Frontline health workers desperately need your support. Too many decisions are being made without key stakeholders. Too many policies are gender blind.
We urge all of you to take these actions with us.
The next video that we will be watching really will present us to stories from around the world, from political advisors and leaders on action needed to accelerate the implementation of the UHC political declaration, and obviously action is now more necessary than ever. Maybe watch that, and then we will move ahead into a more interactive part of the session.
Dear fellow leaders, we know you have a lot on your plate right now.
Every day you face difficult choices to save the lives and livelihoods of your people. So if you hear one message today, let it be this.
To end this crisis and build a safer, healthier future, now is the time to act for health systems that protect everyone.
We have learned a lot about COVID-19, and we know what it takes to build systems that protect everyone. We urge all of you to take these actions with us.
Prioritize universal health coverage now to beat COVID-19, alleviate anxiety, and rebuild trust.
Fight systemic inequities by creating strong social and financial safety nets for those who need them most.
Get specific with your targets and communicate clearly and consistently with the public. Ensure that 2021 budgets allocate resources to health coverage.
Support, protect, and care for health workers, period.
Invest in primary health care as the first line of defense against outbreaks and the foundation of strong health systems. Health and finance ministers should work jointly for that.
Build partnerships through genuine civil society engagement.
Empower women who are proving to be highly effective leaders in health emergencies.
Rate universal health coverage principles more in every crisis response.
COVID-19 has been an extreme stress test for universal health coverage everywhere. It reveals gaps and inequities that should have been addressed long before the virus struck.
Remember, you committed last September to make these things right.
By taking these actions now with us, you can help societies emerge stronger.
Fellow leaders, we can reach health for all. First, we must protect everyone.
I want to thank my colleague Jessica Clark for sharing those two videos with us, and she will now also share with us a slide of UHC champions, which are permanent representatives from a variety of countries here in New York that have been instrumental, of course, in supporting universal health coverage. I think we must always acknowledge the leadership, not globally only, but also here in New York among the permanent representatives from foreign ministries that are very influential in also talking to their counterparts in their capitals of many other ministries. And this slide includes Japan, Thailand, and Georgia, as well as France, Philippines, Indonesia, Brazil, and Denmark, Australia, and Mexico. Thank you very much for everything you have done and continue doing. We now have an opportunity to hear from several of the permanent representatives and deputy permanent representatives that are participating in this meeting. We have around 60 people, and a number of them have asked in advance to make a virtual toast to Universal Health Coverage Day. The first person is a good friend and also a very long supporter of universal health coverage, the permanent representative of Egypt, Ambassador Mohammed Idris.
Good afternoon. Thank you very much, Mr. Warner, and thank you for all dear colleagues and friends. Allow me to thank the co-chairs of the group of friends of universal health coverage, Japan, Georgia, and Thailand, and the World Health Organization for organizing these multiple events during this week, commemorate the universal health coverage, which actually these events could not be more pertinent than it is during this very exceptional year. This year, our health systems have been in a very difficult stress test. The pandemic put an unprecedented pressure on our systems and exposed its defects. Hence, it's paramount importance for us to be persistent in implementing the undertaking commitments to achieve the universal health coverage in parallel with our efforts to continue implementing the 2030 Agenda for Sustainable Development. On the national level and in parallel with its efforts to combat the spread of coronavirus, the Egyptian government is persistent to stay on track in its plan to implement the new universal health coverage system. The system was first launched in July 2019. It provides health coverage for all citizens in the country, including the most vulnerable who are subsidized by the government. Before the eruption of this pandemic, Egypt implemented a campaign called 100 Million Healthy Lives. And this campaign aimed at providing free early diagnosis and free treatment of people with hepatitis C virus and non-communicable diseases, and while also continuing the healthcare services provided for hepatitis C and B patients during the pandemic. The 100 Million Healthy Lives campaign is considered a turning point in Egypt's healthcare system. This campaign and other efforts proved that investing in healthcare systems and its related technology is a must for the achievement of the sustainable development. To conclude, Egypt strongly supports the efforts of the Secretary General and the WHO to make the vaccine a public common good. In light of the recent developments, we encourage the World Health Organization to coordinate with the vaccine producers in order to ensure that developing countries are not left behind from the immunization process, whether because of the questions of affordability or availability of these vaccines, or because of the lack of technology necessary for its distribution and conservation. Again, congratulations and thank you very much.
Thank you very much, Ambassador Idris. The next speaker which have requested to make an intervention is the Deputy Permanent Representative of the Philippines. And it is my honor to give the floor to Ambassador Kira Christian Azucena. Ma'am.
Thank you, Mr. Moderator, and good afternoon, everyone, Excellencies. Let me begin by thanking the co-chairs of the Group of Friends of Universal Health Coverage, the permanent representatives of Georgia, Japan, and Thailand, their Excellencies, for bringing us together to celebrate this important milestone and reaffirm our commitment to universal health coverage. I bring the greetings of my permanent representative. Unfortunately, he could not join us today because he had a previous commitment, but I note that he was acknowledged as one of the champions, and I saw his picture earlier. I just would like to take this opportunity to reiterate the Philippines' commitment to achieving equitable health and financial protection outcomes for all Filipinos, recognizing that health is a fundamental right and a driver for stronger and more resilient nations. Towards this end, we have passed very recently the Universal Healthcare Act to reorganize our health system with primary care at its foundation. While the COVID-19 pandemic has exposed the fragilities of our societies, our government remains focused on strengthening our health system and achieving affordable universal health care in line with our development priorities. We strive for a comprehensive and inclusive recovery, utilizing all available socio-economic instruments to protect our hard-earned development gains. We recognize that international cooperation and multilateralism present the best way out of this global health crisis, as no country can fight it alone, and no one is really safe until everyone is safe. In this regard, Philippine President Duterte, in his statement at the UN Special Session on COVID-19, reiterated the call for universal access to safe COVID-19 vaccines and technologies and life-saving services and products, particularly to the most vulnerable. He also reaffirmed support to WHO and its initiatives, such as the ACT Accelerator, the COVAX facility, and the CTAP. Finally, we must take the lessons learned from this pandemic as we move forward to a more resilient growth and development and a healthier future for all. Thank you.
Thank you so very much. The next speaker is the Deputy Permanent Representative of India, Ambassador Nagaraj Naidu. Sir.
Thank you, Chair. We thank the co-chairs of the group of friends of UHC and the WHO for organizing today's event to commemorate the Universal Health Coverage Day. I still vividly remember during UNGA 2019, India participated in the high-level meeting on UHC, which also saw the adoption of the political declaration. We also took part in the ministerial meeting held just about 2 months back to commemorate the 1 year of holding the high-level meeting. India is also proud to be a co-sponsor of the joint statement in support of the Secretary General's policy brief on COVID-19 and the UHC in October this year. Chair, India is committed to protecting and promoting the right of every individual to enjoy the highest attainable standard of physical and mental health. The 4 pillars of our healthcare strategy focuses on affordable healthcare, preventive healthcare, quality healthcare with focus on infrastructure and delivery, and mission mode intervention. In September 2018, India launched the National Health Protection Scheme, which focuses on expanding access to primary healthcare service through 150,000 health and wellness centers established for the purpose and providing cashless and paperless insurance coverage of about $7,000 per family for a total of 100 million households, essentially covering a population of 500 million, making this UHC scheme the world's largest. The insurance takes care of secondary and tertiary care hospitalization requirements of poor and vulnerable families. We have also put in place a $300 billion economic recovery plan, which is about 10% of India's GDP. Mr. Chair, India has extended COVID-related medical assistance to more than 150 countries. Under the India-UN Development Partnership Fund, we are currently assisting over 20 plus countries with procuring of ventilators, PPE kits, and other testing equipment. Domestically, India is working on 2 indigenous vaccines, which are undergoing the advanced stage of 3rd phase human trials. Simultaneously, we are gearing up to enhance our manufacturing and cold storage logistics capabilities, not just to meet domestic demand, but also to assist all countries in their vaccine requirements. Mr. Chair, the COVID-19 pandemic has highlighted systemic weaknesses in health systems across the world with respect to the capacity to prevent and respond to global pandemic threats. We also need to strengthen global coordination to ensure that the world is better prepared to curb the impact of future health-related crises. The pandemic has also re-emphasized the need for continued funding and investment to strengthen health systems. I thank you.
Thank you very much. We have 3 more speakers which have registered to take the floor. So I would like to ask anyone who have not indicated and who may want to speak to use the raise hand function or indicate in the webinar chat if you're interested to speak. The next person on our list is the Acting Deputy Permanent Representative of Kenya, Ambassador Susan Mwangi. Karibu, sister.
Asante, Mr. Warner. Thank you for giving me the floor, and I would like to commend and thank the co-chairs of the group of friends of Universal Health Coverage and Global Health and the World Health Organization for holding this important event to commemorate the International Universal Health Coverage Day. This year, the world has undergone a dramatic shift due to the anticipated COVID-19 pandemic. Our health system saw the biggest strain of the pandemic in both developed and developing countries, and we welcome the promising COVID-19 vaccine and urge that it may be made available and distributed equitably to all countries, especially in Africa. This calls, as Ambassador Kimihiro earlier noted, for us to enhance our universal health coverage and develop resilient and effective health systems. And let me also take this opportunity to thank Dr. Toda for supporting and highlighting what Africa is doing. Kenya's mission for accessible and affordable quality healthcare has been a central theme even before COVID-19 pandemic, as evidenced in our constitutions, our policies and legislation. To bring the promise of better healthcare services to life, Kenya has prioritized universal health coverage in its National Vision 2030, the Kenya Health Policy covers 2014 to 2030, and the President's Big Four agenda. So Kenya began the UHC journey with the waiver of user fees in lower level facilities, then introduced several government-sponsored insurance programs for the elderly, vulnerable children, for people living with severe disability, pregnant women, secondary school learners, among others. So Kenya is still in the process of implementing UHC at all levels of care. And going forward, we plan to continue to strengthen decentralization of healthcare from high-level facilities to the community level to promptly detect diseases of public health concern and provide adequate referral mechanisms for prompt treatment and care. Fortunately, the UHC pilot phase was a success story. It led to an increase in the utilization of our health services, with over 1.6 million additional hospital visits made during the 12-month period of the UHC pilot phase. So in conclusion, Kenya calls for solidarity and cooperation in assisting developing states to increase investments in public health surveillance systems, emergency response mechanisms, and in resilient health systems. This will ensure that we are better able to respond to pandemics in the future. And equally important, countries need to remove barriers to access to diagnosis and care for those who need it, while also addressing the cost of treatment and ensuring equitable access to healthcare in the true spirit envisioned by the goal of universal health coverage. And I do agree with Mr. Simpson that we need to invest more and smarter. I thank you, Chair.
Thank you very, very much. I would now like to ask Ricardo Monteiro, the Minister Councillor of Brazil, to make his intervention.
Thank you, Mr. Chair. Dear colleagues, good afternoon. Mr. Chair, Brazil is a proud member of the Group of Friends of Universal Health Coverage. Thanks Japan, Georgia, Thailand, and the World Health Organization for convening this meeting to celebrate the International Day of UHC. I would also like to express solidarity to all countries affected by the pandemic, as well as our condolences and sympathy to all families and victims of COVID-19. After almost a year of living through this pandemic, the achievement of UHC and the strengthening of health systems have never been so timely. We believe that promoting universal access to medicines, vaccines, diagnostics, and other health products is key for defeating the virus and saving lives. Now that a vaccine for COVID-19 is a reality, we must also join efforts to combat disinformation and misinformation in this regard. To conclude, let me express our deepest appreciation for all health professionals and essential workers for their resilience during these difficult times. It is time to recall that the commitments highlighted in the political declaration on UHC are more important than ever. I thank you, Mr. Chair.
Thank you very much. I now would like to ask Richard Blewett, who is the permanent representative of the International Federation of the Red Cross in New York and a very long-standing partner of WHO, to take the floor.
Great. Thank you very much to WHO and the Group of Friends of UHC for convening this important event. Even before COVID-19 happened, we at the IFRC, along with our 192 national societies, have put emphasis on universal health coverage and have worked to increase access to health services in last mile communities. Globally, we have for years seen vulnerable individuals and communities struggle to get healthcare they need. The alarm bells ring louder now amidst the COVID-19 pandemic, and we face the combined impacts of the health crisis, the climate crisis, and the wider and longer term socioeconomic impacts. Indeed, we are called upon to design and deliver healthcare systems and services that are accessible to all who need them. Our Red Cross and Red Crescent staff and 14 million volunteers, many of whom work on the front lines, are painfully aware of how certain communities are disproportionately affected and made more vulnerable by the pandemic itself, as well as to the secondary impacts. Persons living in countries with under-resourced health and social welfare systems, recovering from large-scale disasters, and those in conflict and other complex settings, refugees, migrants, and those in camps are amongst the least likely to receive the medical or financial support they need. Even in higher income societies, certain groups are often excluded from healthcare. Persons with disability, older persons, members of the LGBTQI communities, migrants, and many more. This morning, we had an event with IOM, the leader of IOM, and a number of member states on migration. And we took note that the Japanese ambassador spoke on behalf of the UHC friends about the importance of the issue of resilient health systems and the importance of reaching migrants in this current crisis. We need to build trust with communities. We need to invest in scaled up risk communication and community engagement activities as a component of a people-centered health system strengthening approach. You can rely on our network of national Red Cross and Red Crescent societies in this critical work of strengthening community dialogue and community-led approaches, including for immunization activities, both keeping up existing immunization programs and preparing for COVID vaccines. Ensuring equitable access to vaccines and basic health services to those most in need in the pandemic is a humanitarian imperative. You can count on our commitment and our national societies continuing to ensure that universal health coverage is not just a slogan, but it's a reality where there is accessibility, availability, acceptability, and quality. Everyone, everywhere, leaving no one behind. Thank you very much.
Thank you very much. I have not noticed any other requests for speaking from the floor. So maybe just in closing, let me say that I think that the group of friends will become busier as we move along into the new year. Clearly, everyone who participated today pointed out that universal health coverage is the central objective that we must not lose sight of as we recover from the pandemic. And it has been absolutely wonderful to hear the continued strong political commitment from all the member states who spoke today and from the other UHC champions that we saw on the videos. May I then just finally ask everyone if you would like to join the virtual rally we have on the 12th, December the 12th, which is the real Universal Health Coverage Day, and tweet and support the global movement. And the hashtag is protect everyone. All those permanent representatives which you saw earlier in the slide have already participated in supporting this virtual rally, and we would like to see more join. Thank you very much for making time to participate in this celebration today and for your continued support to universal health coverage and leaving no one behind.